Hello, Dr. James Bogash, expert in health and longevity, and today we're going to talk about GLP-1, which everybody's heard of. Think semaglutide, Wegovy, tirzepatide, all of those things, and they all affect or mimic the production of our body's own GLP-1. But there are ways that we can actually increase our own production of GLP-1, which would make sense, and we want to increase it by a little bit, not 2,000-fold like the drugs do, because ultimately there will always be a price to be paid when you screw with Mother Nature that much. We just don't have all the details just yet. So we know that the gut bacteria play a pretty big role in our body's own production of GLP-1. So this study is a review looking at how much evidence we have to support that. And it's very clear that certain fibers, think soluble, insoluble, and resistant starch, can increase the production of certain bacteria that help us, through different signaling pathways, produce more GLP-1. So that would certainly make a little bit more sense. Interestingly enough, resistant starch seems to have some of the best effects. So think like cooked and cooled carbohydrates. So when you cook a potato and then cool it, or cook rice and cool it, different bonds form and it becomes higher in fiber. Those fibers are called resistant starch. So the resistant starch seems to have the best ability to help us stimulate our own GLP-1. But this also raises the question that antibiotic use is everywhere in society, and I know I've seen studies over the years that found that antibiotic use increases the risk of obesity. Well, this could absolutely be a mechanism, and how many people do you know of in their 20s or 30s or 40s that have never had antibiotics? It's a pretty rare scenario these days, and could antibiotics be contributing to the killing off of our microbiome? And then even if we were eating enough fiber, which is grossly deficient in today's society, we wouldn't have the right bacteria to help produce our own GLP-1. So interesting topics, but it really has everything to do with fibers and prebiotics. Keep in mind, a prebiotic is just something that helps you increase the production of your own bacteria, rather than probiotics, which is the idea of giving you your own bacteria. I'm less a fan of more a fan of feeding the bacteria that we want to grow. And that requires a varied diet with a lot of different food stuff, including fibers that help the bacteria that we want to grow. So, as always, I'll post a particular study to this review, or particular link to this review in the description. Make sure you like this video, share it with somebody you think needs the information, and subscribe to the channel.